With over 20 years of experience since she became a registered nurse in the country, Immaculée says that her passion for her job has only grown stronger even as she now passes on the knowledge to the young budding generation of nurses at the Kigali Teaching University Hospital.
So I chose nursing and midwives because when I grew up, my dad was sick and he was caring by people who was not professional. Okay, we were not in Rwanda, we were outside the country. And the people who was treating people in my area was people who was trained, but they was not professionals. So when I grow up and I see my dad sick, treated by people who are not professionals, so I say I have to go to study nursing, and then I will come back to treat the people who was living with my family at that area. So I was 16 years old. So because in RDC, when you need to start nursing, you have to be 18 years old. And I top up 2 years to my age to help me to study nursing. Nurses and midwives are the backbone of the health. If you doesn't have nurses, they are the ones who work 24 hours on the head of the patient. So you have to have a big number, you have to train them. If you doesn't have them, I think you can have a big problem in the health system.
In a statement released by the Ministry of Health today, the Minister of Health, Dr. Daniel Ngamije, thanked and commended the nurses for their efforts and resilience, especially in these times of the COVID-19 pandemic.
This is an opportune time to recognize your valuable contribution to reducing the burden on maternal and child mortality, HIV/AIDS, malaria, and other communicable diseases. We particularly thank you for being on the front line for the fight against COVID-19 and urge you to maintain your efforts and resilience to defeat the pandemic, just as we did for the previous outbreaks.
These sentiments are shared by some of the patients that we found in hospital today.
In the morning, they came and asked me how I feel, and then I tell them, and actually they try to change this for my help. Yeah. So in order to, and actually they gave me the tips how to foods I can use to recover well. So nursings are very important.
For Musho Helen, who has been a midwife for over 10 years, nothing has been more fulfilling for her in her career than the privilege of seeing families' dreams come true upon the arrival of a new family member.
This is a professional for sure that I admire and I practice with all my heart. I love being a midwife, because the midwife responsibility starts from the beginning when someone is just thinking, I'm pregnant. So from the beginning when you're doing follow-up that is antenatal care, and then when you're just following someone from antenatal stage until delivery, and then you see someone whom you've delivered, the babe comes and just a hug, and you remember this at one time, this was just a yoke. That is the rewarding part. That is the celebration of a midwife.
According to the World Health Organization, the ideal nurse-patient ratio ought to be 1 nurse to 1,000 patients, and by standard, every mother should have at least 3 midwives attending to her during childbirth. Currently, Rwanda has 13,500 nurses, with only 10,500 practicing and 2,134 midwives. Nurses are now calling on more people to join the profession to fill the existing gaps.
We need to be recognized to our level, to recognize our level of nurses. Another thing we need is to add the number of nurses and midwives, especially midwives. As I said before, you see the number of midwives is 2,000 like that, around 2,000. For all people in the country is very difficult.
May 12th is International Nurse Day, which commemorates the birthday of Florence Nightingale, the first professional nurse. The World Health Organization also named 2020 the Year of the Nurse in recognition of their contribution they make and the risks associated with nursing shortages. According to the International Council of Nurses, at least 90,000 health workers worldwide are believed to have been infected with COVID-19, with more than 260 nurses losing their lives to the disease.
The theme for 2020, Nurses, A Voice to Lead, Nursing the World to Health, demonstrates how nurses are central to addressing a wide range of health challenges. It will also inspire nurses and make the public aware of their contribution in healthcare and health management. International Nurses Day also provides information and resources that will help to raise the profile of the profession so that the new generation also can know about this noble profession. Reporting for RTV, Gloria MUTESI, Kigali.